Yes, sir.
Getting back to the relationship between oxygen and some of these attacks, will oxygen help to relieve them as a temporary thing?
Well, if you're short of breath and have a low oxygen level, using oxygen at that time will make you less short of breath. So in that sense, yeah, it'll make it less severe, less painful, if you will, for the patient. But it's not going to prevent the exacerbation that led to that. That makes sense to you?
Yes, but how about the, when you have shortness of breath and then leads to coughing, a full-blown attack, does the oxygen tend to alleviate that?
If it relieves the shortness of breath, it's not going to make the cough go away, and it's not going to make the fever and inflammation, those sorts of things go away, but it would make you less short of breath at the time you're on it. So, I mean, the answer is yes, it's helpful, but no, it doesn't prevent everything. It's part of the answer. Russell?
I think he's speaking of pulmonary fibrosis. Is this going to work both with COPD and pulmonary fibrosis, or are they two different horses?
They're two different horses, but you could have both.
Dr. Giessel,
Yeah.
I was taken off Advair and put on Semicol. Is it the same medication?
Not exactly the same, but pretty darn close. They both have an inhaled steroid and a long-acting beta agonist. Okay, it's called that.
But they work pretty much the same.
Yeah, they're in the same class, and they, as you know, the delivery system is different. Some people prefer the dry powder, some people prefer not having the dry powder that's in the Advair. And the chemicals that are being delivered are slightly different, but they work the same way. Yeah.
I take 10 milligrams of prednisone every day, as well as Advair, reliever, albuterol, and Ipro, something or another, and a ventilator, and a nebulizer. I go to Dr. Giessel. Anyway, he wants me to come down on it because prednisone's not to do bad things. I cannot breathe if I don't take it. You're saying about this other medicine that might help. He's not mentioned.
And you know, it kind of gets back to this question over here. You know, if you're using the prednisone because someone keeps having these bad episodes, maybe adding the Daliresp, well, we'd be able to get by with a lower dose of prednisone for that reason. If you're someone who, on whatever dose of prednisone you're on, every time I drop it just a notch, I get worse, I personally would be more skeptical of that medicine helping. You know, it's a new medicine we're still kind of learning about. And, you know, it's been out for maybe a couple years, year and a half, 2 years. So we're still learning how to use this drug. And there's still studies ongoing looking at it and what's the right setting to use it in. So some of my answer is based on my impression right now, and my impression might be different a year from now. So talk to John Morkent about it. He's an open-minded guy. I'm not going to tell him you said that. Yes, you have.
How do I have a little bit of everybody's symptoms, but I never smoked, I never whacked?
Unlucky.
That's why I don't believe
You know, it is true that you can lead a clean life and have things happen to you. And, you know, it's not true that every disease is due to something someone did wrong. You know, that's...
because I have a little bit of everybody, everything I have, but I never smoked, I never.
Work in a research lab?
And I was a hairstylist.
Chemicals. Chemicals.
Everybody can with this way, okay.
Sorry, I don't have better answers for you. Yeah.
Have they done any research on hairspray? Seriously, it's a very powerful
I'm sure those epidemiologic studies have been done. I'm not sure I can tell you exactly what they showed. My guess is there probably was some small increase in the incidence of lung disease, but I'm kind of guessing. I don't really know. But it's not going to be a situation where, you know, there's this dramatic increase. Because if that had been found, you know, the authorities, EPA, doctors would be lobbying for banning hairspray.
If they hear you speak, they'll do it. If they hear you say that.
Yeah, but, you know, I would only say that if I knew it to be true, not because I thought it could be. I think it's important to speak from a scientific viewpoint, not.
Right, I think that was just not okay. So that, they would pick up on it just to say something else. Say something else.
Yes, sir.
Someone brought up the alerts of ozone or bad air. How much ozone really causes problems?
Well, certainly when the air quality is bad, if you already have lung disease, it's going to have more of an effect on you. So just like, you know, someone who's up here and they get a little bit worse, it's no big deal, you know, from the ozone being higher. If you're down here just barely getting by, it's, again, that difference between 1/10 of a tank and empty. So that can be a factor in someone who already has lung disease. Just like this hot weather, no one much likes. But someone with bad lung disease, it has much more of an effect on than someone without bad lung disease.
The problem I have is quantifying. I don't know the difference between how much levels of ozone there is in the orange level or the red level or normally. What are we talking about, parts per million or whatever?
I can't answer that one. All I can say is red's worse than orange.
Okay.
Doctor?
Yes.
I woke up one night, my whole left side was, I couldn't move. In about a minute and a half went away. So I got in the car, went over to the hospital, and they run all kinds of tests and everything. And I was, anyway, to make a long story short, I went to the bathroom, and when I come back, my wife had signed the thing. And what it said was I had too much CO2. And from a concentrator, you know, I own a concentrator, you know, at that time about 12 hours a day, you know. And it said that that's what caused the problem with my left side. Does that sound?
I'm a little skeptical.
Well, I was too. Like I said, I probably should have, when I came back, when my wife was on, I said, what did you, so she told me, so I thought, it was shift change. And so the woman doctor came in, which was my doctor, she explained to me what the other doctor already wrote on his thing. But I said, well, what is the problem? She said, well, you got too much, you know, the doctor concentrate on it. You just build up so much that my left side, like I said, I woke up, you know, and I thought maybe, you know, I was having a stroke or something.
It is true that some patients, if they get with lung disease, who get too much oxygen, it suppresses their, what we call hypoxic drive. That is, they have less of a reason to breathe, so they breathe less, and the carbon dioxide level goes up. When that happens, it most typically causes sort of a global effect on thinking, not one-sided. So that when I said I'm a little skeptical, I'm skeptical on that basis.
Well, sometimes, like I say, I'm on the concentrator. I get up like 3 o'clock in the morning and get on the nebulizer. Then I get, you know, sometimes I'm on the concentrator, you know, before or after. But normally, if I can tell if I'm on that concentrator for straight, say, 14 hours or something, I feel like I'm getting too much. I mean, it's almost like I can take it off and take it, concentrate off, and within 15, 20 minutes, it's just normal.
You feel better.
Yeah, be a whole lot better
Well,
than
it is possible that what you're experiencing is your carbon dioxide level being higher because your lung disease is severe enough that it's suppressing your drive to breathe.
Well, that's what you said, but the carbon dioxide is what you said I had too much of.
Yeah.
So, but it just, you know, naturally when you wake up, you know, your side is kind of numb, you know, and so but that's what you told me, so, of course, my brother don't believe it, but that's what happened. But like you said, it is powerful for it to, where I have, I can get too much, because like I said, I can be on it and then get off it for 15 and 20 minutes and just
It's possible that it's on that mechanism.
Thank you.
Oh,
I'm sorry.
I'm not sure, is this on?
Yeah,
Okay, this may be a follow-up, we were having trouble hearing some of the questions. My question had to do with oxygen use. Is it meant if you go on oxygen, will you stay on oxygen? You know, the folks that use it at night only, or exercise only? What is, I mean, is that
Well,
meant?
You know, I think sometimes when patients ask that question, will I become addicted to oxygen? That is, will I have an increasing need, like someone who's using heroin and they need more and more and more? No, I don't think that's true. I think it is true that if you use oxygen and you feel better and you can do more, it's natural that you will want to continue to use oxygen because you will continue to be able to do more, and you don't want to go back to how you were feeling before. Now, if that's addiction, well, that's not how I would use that term. But it's not true that by using the oxygen, it causes some change in your body where now you have to be on it, whereas before you didn't have to.
But if you are doing any activity, then it's probably a lot harder on your heart if you're not using oxygen, is that right?
If you have a low oxygen level. And that would be the case, you know, if you start oxygen now, and a year from now, unless your lungs have gotten better for some reason, it'll probably still be the case. If it's not the oxygen that caused you to need it a year later.
And then I have